I always get worried with acute presentation of vertigo. What are the things I should be looking for if it is a stroke or not?
So there's some red flags that you should look for, and if you see those red flags, you need to refer immediately. So the first red flag is hyperacute onset. If the patient was doing something and they had this onset within a split second, that suggests a stroke, for example, embolic stroke, particularly if, for example, they were performing a Valsalva type maneuver, bending down or lifting something. The second thing is if they can't walk. If they are falling over or they've got gait ataxia, it's a big red flag. The third thing is if they've got a headache at the back of the head for the first time, they don't normally suffer headache. And the reason for that is 40% of posterior circulation strokes present with headache. So headache plus vertigo, red flag. Then the other thing you need to look for is hearing loss and vertigo. There is a branch of the anterior inferior cerebellar artery which supplies the labyrinth and the cochlea. And if that blocks off, you have acute hearing loss and acute vertigo from a peripheral cause. But you will also have central signs like gait ataxia, numbness, etc. So it's always important, of course, to look for focal neurology. But if you have those red flags there, you definitely need assistance from your colleagues.
And irrespective of age and other risk factors?
Yes, I think that is the case because young people can have strokes as well. You have a young person in front of you, and if you attempt to make a diagnosis based on risk factors when you have someone with acute vertigo in front of you, you have the potential for disaster. And I think that approach is very anxiety-inducing for GPs. Why don't you just have your red flags, and these patients won't be very common. When they appear with their red flags, you ring your colleagues in hospital and ask for assistance. It's not something that will lead to you massively over-referring to your hospital colleagues. In compensation, and part of these videos we are here, we're teaching you how to manage very common conditions like BPPV, so you will actually overall be reducing your referrals to the hospital.